appreciate you talking about the Protect 340B program. I was so proud to lead this effort. And certainly, as we've heard today, Congress's intention for the 340B program is to support safety net providers and their ability to stretch their scarce resources and provide more comprehensive services to vulnerable patients. Congress certainly did not intend for the 340B program and those discounts to subsidize the profits of Fortune 100 pharmacy benefit managers. And I thank Mr. Rose for recognizing that. I was proud to work with our colleagues across the aisle to introduce Protect 340B to stop PBMs from, frankly, pickpocketing 340B discounts so that we can ensure that the benefits of 340B reach the community health centers, the HIV and AIDS clinics, and the rural hospitals that Congress intended to support. And I want to thank Congressman McKinley of West Virginia, who has been an absolute champion of this issue. I have been so grateful to work with him and his team every step along the way. His commitment to West Virginia, the safety net hospitals, the rural hospitals, and the communities that rely on 340B is apparent through his dedication to this. And our bill is in response to the stories that we have heard from pharmacists across our districts. PBMs have established 2 tiers of payment for pharmacy dispersed drugs, one for chain and retail pharmacies unassociated with 340B providers, and another significantly lower rate for 340B pharmacies. Years of market consolidation have given the 3 leading PBMs incredible market power, and they can effectively dictate terms to smaller 340B pharmacies. So what that means is PBMs are essentially pickpocketing 340B savings from safety net providers. And instead of helping the healthcare safety net reach more patients, the 340B savings are subsidizing the profits of some of the largest, most profitable companies in America. And that means that those safety net hospitals, those rural hospitals, those federally qualified health centers are not able to put those savings towards care to patients. And our Protect 340B Act would hold PBMs accountable and prevent them from applying these predatory business practices to the local health centers, the rural hospitals, and other federal grantees. It would also create a national clearinghouse to track 340B discounts and make sure 340B drugs are not included in states' Medicaid rebate requests. Together, these changes would restore the integrity of the program and protect the healthcare safety net so many of our constituents rely on. I am proud that for over the past 2 years, many states, including Virginia, have passed laws to protect the healthcare safety net from these predatory business practices. But it's not enough. A federal standard is necessary to ensure consistent and broad protections for healthcare providers, and importantly, to actually ensure that we are enforcing the law. And we're seeing momentum towards that moment. Currently, our bill has more than 90 co-sponsors, and I welcome the rest of our colleagues to join our efforts. Certainly from tonight, people should be able to see that this is an issue that many people from across the country and across the aisle certainly can get behind. And I urge my colleagues to consider joining us in this legislation.